And joining us now, Dr. Ashish Jha, director of Harvard's Global Health Institute. Dr. Jha, thank you so much for taking the time this Sunday morning and chatting with us. I want to start right there with what the president's been saying for weeks, that the only reason the cases are rising is because the United States is testing more. He said the virus will disappear, that the worst is behind us. Give us the reality about how much increased testing really has to do with the uptick in cases across the country.
So good morning, and thank you for having me on. So we have increased our testing, and that's good news. But it's very clear to all the experts, including the experts from the CDC and the president's own task force, that that's not what explains what's happening in the United States right now. The increasing number of cases we're identifying is because there are more people getting infected. And certainly increasing testing wouldn't explain our hospitals getting full, our ICUs getting full. So this idea that testing is driving all of this is just simply not true.
Now, three of the states that are doing the worst right now are also three of the biggest: California, Texas, and Florida. Texas and Florida were among the first to reopen, but California has been a little bit more cautious. But now we're seeing some states like Texas, Arizona, and Florida pause and reverse their openings. And I'm curious, what lesson should states draw from this?
Yeah, so the key issue here is that we've got to let evidence and science and data drive these decisions. And those states didn't. They opened when things were still, the number of cases had not been declining steadily. And they opened too fast. I think, as you mentioned in your last segment, or someone mentioned in your last segment, too many states opened too fast without letting data drive those decisions. So now I think we're going to see reversals. I'm afraid that we might even see a couple of states at some point go back into shelter in place. And I'm hoping that we're learning our lesson and that we can really open up our country much more safely as we go forward in the next days and weeks ahead.
And we learned much more about this virus. The CDC said just this past week that there could be 20 million Americans who had the disease but were asymptomatic, so they never knew they even were carrying the virus. So how much harder does that make it for public health experts, for local officials, for the federal government to ultimately stop the spread of the disease?
So, yeah, the CDC report didn't necessarily argue that most of those people were asymptomatic. They said we've had a lot more infections. A couple of thoughts on that. One is it's a reminder that most of those people weren't identified as having COVID because we didn't have enough testing. So the lack of testing is why we have so many more people infected than have been identified. Second, for months we've been telling people, unless you're really, really sick, you can't come in and get a test. So if we really want to get our arms around this disease, we have to ramp up testing. Even today, we're probably missing 70–80% of the cases that are out there on a daily basis. So we're way behind on testing, and we've got to be doing a lot more.
And the case count is surging, but so far the death rate has not been. Now listen to what Vice President Mike Pence did have to say about that.
We can still take some comfort in the fact that fatalities are declining all across the country. There literally was a day 2 months ago this week where we lost 2,500 Americans in a single day. This week, there were 2 days where we lost less than 300 Americans.
So Dr. Jha, is he right? Should we take some comfort in that, or do we just not know yet?
I mean, it's always good to take comfort in fewer people dying, and so I do. But the question is that sustainable? And there are a couple of reasons that make me worry that they're not. First of all, death is always a lagging indicator. When hospitals start getting full, you start worrying that eventually in the days and weeks ahead, we're going to see increases in deaths. So I am worried about that. Second is, a lot of these are young people who are getting infected who are less likely to die, thankfully. But these people are then going to go on and infect their parents and grandparents. And so we're going to see, I believe, increases in the age of people getting infected in the weeks ahead. So I don't think we're out of the woods, and I don't think we should assume that, therefore, this is no big deal. We still really need to work on curtailing this disease.
So much more to learn about this disease. Dr. Jha, thank you for coming on, sharing your expertise with us this Sunday.